he has a lieutenant friend. And before I was discharged, that man told me to come by his office and get my medical records and my dental records.
Time out. What was the date that you were?
November the 4th, 2003. Dr. Chittum. Should start out, dear Mr. Martin.
Yeah, wait a minute, I'm still trying to. This is what year is this? Come on, goddamn. Oh.
I went down to Charleston before this appointment of the date you're pulling up.
November the
4th.
4th. Okay, and there's a letter, right?
It's printed out as a progress note. Yeah, letter. It says letter. Local title letter. Standard letter.
Okay.
Okay. On a little bit of explanation before this. I went to my last checkup after my lumbar fusion with Dr. Chittum. These are the people who, the very first time, I went off on.
Okay.
Me and Mr. Chittum did not get along. This is the one who told me, I am not doing this surgery because I believe it will benefit you medically. I'm doing this because you are telling me you're in this much pain. That's the reason we're doing this, is to try to relieve pain. This is also the individual who did the surgery who scheduled 4 hours and it took them 8.5 hours to do the surgery.
Okay.
So there was hostility among us even before and after. Now, this is really and truly, and we're going to get into a lot on 2003, but this is, I want you to, at a different time, print this out. That's one thing I want you to read, and as a psychiatrist, you tell me that's a good way to treat somebody. You tell me if that's somebody that should be treated. And is there no way for you to get the paperwork that I faxed you before, while we're speaking?
I don't think so, but let me just finish looking at this very quick. Unless they put it in my mailbox, which I haven't checked today. So hang on 1 second. Okay, but you asked him a number of questions.
I did, and it was a very pissy. To me, with our relationship and our situation, it was a very pissy way to answer majority of the answers that he answered.
Okay.
And it was a definite sign that there was, and after him doing this surgery and the extent of the surgery and what he fixed, and me asking these questions with different things, this is where y'all failed me. Because I should have been more, not y'all, but the VA system, healthcare system, because I won't get into that. But this is what lit my fuse. I want you to understand that.
Let me ask you a quick question.
Okay.
After the 8 hours of surgery.
Yes.
And your post-op recovery, etc.
Yes.
What was?
The reason I sent this letter, I went down there. I had a scheduled appointment with this physician as my last checkup. I took my mother, because by this point, I took my mama to every appointment. She's been a witness to all of the things I'm telling you my mama's witnessed face to face. We went to Charleston. We spent the night. We paid out of our pocket to stay there. I showed up to my appointment. The woman at the desk told me Dr. Chittum canceled that appointment. That day, they never called me. They never notified me. They never sent me a letter. And if you look in her notes, it says his efforts were very commendable. So I want you to, and it really bothers me that you do not have this paperwork because.
John.
I am, but there's a psychiatry note in here, and it's one thing I wanted you to read about this. This is and you're a psychiatrist, so I feel like this would be relevant in your field.
Okay.
This veteran may seem to enjoy ill health on the face of it.
Now where's this one?
This is a CMP exam, 1/15/2009. where they could get me my unemployability and get me to 100% and shut me up. And I hate to put it that way, but that's it. If you look at all the timelines, and let me go back to my certified letters, my certified health records, because part of that was sent to you.
Wait a minute, now just be cool.
Okay.
Ask me something.
Well, that was just one more.
After the surgery you had, that Chittum did,
Yes.
was there any improvement?
Did you read the letter? I mean,
No, I want you to tell me.
yes, the pain I had before surgery, yes, it was better. But I still have a constant pain and still do in my lower back. That's my point.
I'm not arguing that.
Okay. Well, yeah, he did his job. I'm not saying he did negligent surgery. I'm glad I did that surgery. I'm glad I went through it. But you've got to understand, for a year before that, he treated me like I was a hypochondriac, just like this psychologist said. I believe this veteran may enjoy ill health. That's how Dr. Chittum treated me. And then he went in and opened me up and seen that there was more of a serious problem than that he ever gave me credit for. Does that not explain something?
Yeah. I explained that he was a jack, he was an asshole, but as a surgeon, that's fine, typical. But let me ask you this, that's no excuse. But now, after that kind of surgery,
Yes.
you obviously were in the hospital for a couple of days.
Yes, I was in Charleston.
Okay. Did he come
No.
after surgery? Did he speak? Did you?
Yeah, I was pretty medicated, but I think he walked in the room and talked to my mother. No, he never spoke to me. No, we never talked after that. And Dr. Bailey, I believe, is his supervisor, and the one that the day I told you the man was 104 years old, he was older than the dirt that we was walking on. The day I went off, I believe it was Baker or one of them that came in with Chittum. Well, after a checkup at the VA in Columbia, he said, well, we got you up for walking again. And I'm like, yeah, 8.5 hours later, you know. And then he kind of, you know, made a piece of comment and walked off, and then, you know, and then my appointment in Charleston was canceled. That, you know, with no notification, that can be verified, that can be checked out.
Okay. Now, go ahead.
And then, I mean, I have a letterhead about our meeting.
What are you trying to prove to me? Why is it necessary for you to prove something to me?
Because I've never had nobody like you listen to me.
Well, I'll tell you one thing. One way to stop me from listening to you is to go on.
Okay, but there's one more issue then let me talk about.
All right.
And you've got these copies, you can look them over later, the certified health records. I did that when I was in the military, and that physician told me, he listened to my story, he stamped all of my health records certified to be true copies. He certified all of my dental records certified to be true copies. He told me at that point to take any doctor's appointments, always get a release of information and get your records. So for 20 years, I did that, and I have oodles. So I guess maybe, let's pause this for a minute and let me get back to it, but maybe OCD is what I'm trying to tell you, or compulsive, or obsessive needs to be added to my psychology report, but anyway, the certified records showed this. I was treated, and I'm having dental issues now. Through the VA will not cover this surgery that is noted in my dental records that I have a very bad crossbody. Well, you've got to imagine, 20 years later, it's gotten extremely worse. I have an autoimmune disease called ankylosing spondylitis, which has arthritis, pain, fuses bones together. So part of the surgery is breaking your jawbone and fuse it, and you have to have your mouth wired shut. Then you have to have braces. So, which scares me because my jaw's confused. Yes, okay, I understand that. But I'm at the point where I don't want to lose my teeth. But the VA won't cover this because after that surgery, they have to put braces on you. And they classify it as cosmetic. Now, would I wire my mouth shut and take a chance as an AS patient to have this surgery to keep my natural teeth just for a cosmetic purpose when I am not by no form, other than these black eyes, an ugly person? I got a pretty smile. You know what I'm saying? But it's something that needs to be taken. I was married to a dental hygienist, so I know all this.
Listen. When's the last time you actually been to an orthodontist or surgeon, dental surgeon, oral surgeon, or what?
I come down there to Charleston, and in the past year, I have also applied for implants in Columbia and talked about the surgery in Columbia.
So what did that dental surgery consult say?
They said the VA does not cover this procedure.
No, I'm saying, what did they say?
I had severe, the same thing that was diagnosed when I was, in the military, it was diagnosed as the crossbite, but now it is listed through y'all as a severe, because my top teeth are pushing in my bottom teeth, and they're eventually just going to pop out, or I'm going to have to have them removed. My tongue is way bigger than my bottom teeth. But anyway, as I was looking after this, okay, well, I mean, I have to keep going because there's one thing I got to get to. Okay, while I was looking through my dental records, after getting pissed off about this, I noticed something. And this was about a year ago. And it's been a hell of a year, and I've been off track. So, I'm back on track now, I really am. But I was treated by a rheumatologist in the military, and I have certified medical records. He treated me with Feldine and Pamelor. Both of those are autoimmune disease, back in the 1990s, used for multiple sclerosis. I was discharged under Pamelor and Feldine.
How much Pamelor?
That's in the paper. It is in the paperwork that I mailed to you. All of that is in the paperwork.
A tricyclic antidepressant and non-steroidal anti-inflammatory.
Okay, but treated by a rheumatologist at the age of 21. I was discharged under musculoskeletal and upper thoracic spine strain, with no mention of, and there is a second and third degree, diagnosis section where they could have listed anything like that. Then the VA, and it's noted in these things that I sent you, I brought my health records. I've shown them. I brought up everything, HBLA, and plus the HBLA positive with the treatment that they were giving me in service. My point being is, I keep filing a claim for it, and it's because I've been through the VA system. I worked at the VA system at one point. But there's a claim called a 5011, and it's called disability due to negligent health care. And I have filed it through my regional office, but they keep listing it in a different term. I know there's a claim called 5011, and I know it is disability due to negligent health care, and that is the claim I want listed and I want filed. That is my main issue, because I want it connected that what they treated me, the doctor that treated me in service, and the way that the VA has pushed me from doctor to doctor that had nothing to do with an autoimmune disease for 20 years, mentally, and there's proof in the 30 pages I sent you, mentally pushed me down, addicted me. If you look at the medications, morphine, 120 I know, but that's what led me where I'm at now, and it's negligent, and I won't.
Okay.
That's my point.
So you want a disability due to negligence? Is that what?
No, see, I am 90%, and then I can live off that the rest of my life. It gives me all the benefits I need. But I am 100% due to is the way they did it. And I know you're probably not going to understand this, but the meeting with Mr. Byro, the network director, there was a man from Washington, there was 14 people in the room, and they sit there and told me, go to one psychiatrist, get one prescription, never go back, we'll get you to your 60, then we'll get you your 100. And that is in the time work of my meeting with Mr. Byro, that's what happened.
Okay.
So I'm at 100%. It's not about the money. It's about, I want that claim for negligent health care listed because I've got 7,000 pages that the VA sent me. I asked for my rheumatology records. They sent me $50 in charges of postal records and sent me my whole VA file. 2 boxes, 7,000 pages, and binders. So the reason I'm saying the obsession is because I'm going through every binder and I'm highlighting every part and I'm sending that to New York or California with my service records and I'm going public. Because unless this, I want this claim, I want somebody in the VA to be accountable for pushing me through a system, and there was medical records there that they never ever attempted to try to find out. I mean, I was treated really like a hypochondriac, a drug addict. I mean, you really don't know my history. And when I say I want to see you more than 2 times a month, I'm not telling you that because I just want to annoy the hell out of somebody. Anyway,
I know why you should want to see me twice a month.
Actually, you need to talk to Mr. McDonough because I have had and know the process, and there is fee basis and there is local psychologists that I can talk to here.
I understand that too.
And still keep in touch with you every 2 months. But I do have issues about this that I need to get out.
Well, then I tell you what. Why don't you stop mentioning me?
I'm not trying to come out that way. I'm not.
I know you're not bitching at me, okay? I say convention about some legitimate bitches, okay? Now let's talk about you and what actually would make you a happy person other than sticking your foot up the VA's ass, because that's what comes across.
And that's how it is. That's my problem. That is my problem. I mean, like coming here, my anxiety level, and I've had my second Valium today. And this, doctors, and go back to my early records of going to the VA in Columbia and look at how patient and
I don't want to do this.
I was totally different.
Yeah.
Okay. Well, everything else, you want, now, my stepdad told me if you go to buy a used car and you go to test drive it and you turn the key and it won't crank, don't buy it. I didn't listen to him. I rented a condo for $1,200 down. When I finally got in there, it was piss stained by 3 chihuahuas, tore all the hell. So I've been listening.
Didn't you inspect the damn place before you
the lady I'm renting from has my disease, ankylosing spondylitis. My friend Sue about the hip, and I did tell her, and December the 1st, she is having hip surgery. So I'm happy on that end. But it's Sue's friend from New Jersey. She's just in a bad situation with my disease, and we didn't know it was in the shape it was in. But I took 2 weeks, went to my mom's, which, oh Lord, is a whole different ballgame. But I stayed with my mom for 2 weeks. They came in and took up the floors and put new carpeting down. She took out all the wallpaper, had a complete painting, and it is a beautiful condo on the 3rd floor, twice the amount of room. I've got a balcony overlooking the golf course, and it's only $100 more a month. So in the end, I come out to the good, but it's been stressful. He did all the painting, all the wallpaper.
Elevator?
Yes, but as of yesterday, it went down for 4 weeks. So me and my Cocker Spaniel with arthritis in the hip are having a little bit of trouble, but we're doing the best we can and not going out quite as much. But the elevator's getting replaced, and which is good because, that's a brand new elevator.
Yeah.
Yep. Yeah. And on that front, he did all the the construction, I had to pretty much stay in my room for 3 weeks while he did all this. So it's been a hell of a month, 6 weeks for me, it really has. But it's all come, you know, with the construction, and I mean, I'm kind of OCD.
Did you have to pay for that?
No, no, she paid for everything. But it was having someone there. He come on his lunch break every day, and then after work every day, and then on Saturday and Sunday. So, and it was only one person doing the whole condo. So, it was a lot, but it's over, done with, and I, you know, I survived.
You're happy with it, and you're happy with it.
Yes. You just don't know. My bed, when I have a flare-up, and this week I had my worst flare-up, which I need to tell you, my rheumatologist, she pretty much just told me at my appointment, and just out of curiosity, why would a rheumatologist test me for, what did she test? A venereal disease, hepatitis. I've never in my life been so insulted, but she checked it, I'm negative, she gave me till May and told me, because of my pain level, that I had to go on a biologic by May. And that's, you know, I had a really bad time with 2 years of Humira, so going on a biologic, it is a milder biologic, it has less issues with it. I've researched it, I understand that, I've talked to people who's been on it for a long period of time, but...
What about the Drexate?
No, she's going to put me on Emerald.
Oh, okay. Oh, yeah, all right.
Injectable, once a week. But, you know, it's just, I know it's controlling my disease, but it's also destroying my immune system, so that's heavy on, that's been kind of just bugging me. But I just got, you know, my symptoms are getting worse. I'm starting to have symptoms that in my hands and...
Okay, wait a minute. Now, you got a little miff because she checked you for hepatitis.
Hepatitis, yeah. Yeah.
She also checked tuberculosis.
Well, that's because she wants me to go on a biological. She wanted me to do it then, and I told her, you know, she said she'd give me till May. But when I came back in May, I had to start Emerald. Or Remicade, one of them.
She's being straight with you, that's for sure.
Well, she was 22 years old, and rheumatologist I've never seen before, but that's one thing, you know, I mean, how many people walk in with ankylosing spondylitis of all diseases? And I know y'all deal with a lot of rare diseases, but with somebody with a rare disease, it would seem like they could find one rheumatologist that would treat you on a constant basis instead of seeing a different rheumatologist every time you go in there, because you have to relive it and retell that story and all your symptoms, and if you kind of get one doctor for a 2-year period, it kind of alleviates that, and they can see your progress during a 2-year period instead of 7 or 8 people seeing what's going on and having 7 or 8 opinions.
Have you ever seen a physician for 2, 3, 4 years?
Dr. Fluckway, 8 years.
Okay. And at some point during that time, told that individual, that physician, something new that you had not told him before, or just forgotten, or just seemed germane?
Not seeing him on a regular basis. I mean, because, you know, as with my disease and my back issues, it's always been like with my ankle. I mean, it's always been a different flare-up at a different time. So since he treated me over an 8-year period, he's seen when my ankle went out. He's seen when I had hip problems. He's seen when I couldn't raise my hand over my shoulder. He's seen when my hands, I made an AM appointment. He's seen my hands swollen. As to where when I see 7, 8, 9 doctors, they're not seeing that. And when I go there, I'm taking a Valium, and it's been, you know, I drive almost 3 hours. So, you know, I'm better during a certain time of the day. But my mornings and my nights I'm a totally different person. I look like
when you saw Dr. Wolf, and yeah, I'll interrupt you.
Go ahead. I know, I'm sorry.
That's all right. When you saw Dr. Wolf, did you not feel as though she gave you a good exam, listened to you?
Yes. I'm not trying to dog her in any way.
Well, hold the hell out of me. I know you're not trying to dog her. You're dogging the system. The system is what it is. It's better than it was.
That's my session. It's gonna be even better. I'm gonna go in front of Congress. I know you think I'm crazy. You're gonna think I'm even crazier, but I'm gonna be heard. I'm going in front of Congress, and it needs to be more veterans in the system that are qualified for a system that knows what's broke in the system to fix the system. Because the way it's been going, it ain't right, and it's not getting any better.
It's not getting any better.
There's so much you don't know. That's why I want to see you more often. 3.5 years before my meeting, listen to me real quick. Before my meeting with Mr. Byro, I was on 40% disability, living with my mother who was 5 Social Security. Luckily, the trailer, the truck, my car was paid for. All we had was lot rent. But there was days I had to drive from Fort Long to Columbia with just enough gas and a peanut butter and jelly sandwich in the side seat. I had to go to my appointment, make it to my appointment, get out of my appointment, and get the travel pay before they closed so that I could get home because my car had enough gas in it. Now, veterans have to wait 40 days for travel pay?
I don't know.
I'm telling you, they changed it. You got to wait 40 days for travel pay.
Do you know why they changed it?
Yes, I know. There was some people who was abusing the system and getting paid $5,000 or $6,000 a year. That should be on y'all. That should be the doctors.
It should be on the doctors. It should be on the system. I'm not saying.
Well, I mean, y'all should be able to flag a patient that's abusing the system if they're coming for appointments for no reason.
Hey, listen.
Then they wouldn't get no travel pay.
I have said this before. The system is imperfect.
The
system is better than it was. That much I can tell you.
Okay.
And I can tell you that based on the fact that I've had experience with the system before you were, I guess before you were born, no, goddammit, but before you were 10 years old. Right? So, anyway, you've got a lot of legitimate gripes. And I hope you get your chance to deal with it. But, why not take your opportunity, anyway, listen up, take your opportunity to work on you, okay?
Honest to God, in every aspect of my life, and see, that's the thing, you see me, my anxiety is so high when I can't come here, but I have worked on. Why is that? It's because of the 30 pages that I sent you, that I faxed to you. If you go through them, it's what I've been through with doctors. You are an exception to the rule.
Well, if I'm an exception to the rule, why the hell should you be anxious coming to see me?
Because of the issues, the topic that we were going to talk about, the 30 pages I mailed you. I faxed you. I mean, I just want you to understand, at my first point of the VA, and it's documented, I was a perfect patient. I did everything they asked me to do. That's my point. And it's what they put me through that put me in the situation I'm in. My snap, if what you want to call a snap, that happened to me in 2003. I'm better. I've been through the depression. I quit my snap. When I finally realized after Dr. Chittum in 2003, I was a licensed property manager. I faxed me and my handyman, turned in 2 weeks' notice, moved to Myrtle Beach. Was homeless twice in the state park. Me and my Cocker Spaniel I got now. Lived out there in July with a box fan. I waited tables. He ended up just packing up and leaving in the middle of the night, so it was just me and my dog. And then that's when I moved back in with my mama.
That must have been pretty miserable, man.
Nobody would believe I was sick. I was getting no help and disrespected by the VA healthcare system.
That must have been.
It was. It was. It was the low point in my life. And for 3.5 years after that, I come home, I moved in with my mama. I filed her Social Security claim for fibromyalgia, which she was turned down through the judge. finished with the VA, I started my own. And see, the one thing I want you to understand, I am like this now. I've represented 3 people in front of North Carolina, Charlotte, North Carolina, Social Security disability hearings. I've been in front of 3 judges. 2 of them told me I represented the clients better than most of the lawyers that walked in there. I can speak.
You know why? You know why? You know why you did?
Why?
Because you listened to what they were saying. You knew exactly what the patients were saying. Okay?
Yeah.
And you presented that to the judges, to the judge, in clear and concise fashion. Okay? And without a bunch of bullshit. And because you cared what happened to those people.
And I care about the veterans in the system right now that are getting the treatment that I received. And I know you're saying it's better. I know you're saying that, and I'm not doubting that. But
It's not perfect.
But there's a lot of veterans that are still not getting the treatment that they deserve.
Yes.
There's some falling through the cracks, and until people's stories are heard with facts, and that's the one thing. Like I said, I've had my medical records since the day I was discharged. I've got certified health records from the military, dental certified be true copies of dental, and I've got 7,000 files of VAs from Washington appeals of my whole regional office case of my benefits. That's going to a big law firm.
Let me ask you a question. In all of your time working with the VA, imagine that you have encountered at least 1 or 2, maybe 3 or 4 Vietnam vets. Okay. And the vast majority of those vets who were actually in Vietnam, in combat in Vietnam,
saying some bad things.
oh yeah, and the vast majority of them have true post-traumatic stress.
I understand that.
Okay. Well, tell me something.
And while you're on that subject, the pages I sent you, it goes back, look back in the years of my mental health, and it's highlighted and marked up under it. I mean, I was a 7 and a 9 for high anxiety, anger. I mean, all the way back to 2003, 2004. I just sent you 2003, 2005, 7, 9. I mean,
Okay.
you're the only one that's ever prescribed me Valium after all those,
I'm asking you a question.
Okay.
Obviously, hypothetical question. Why should it take, if someone came up to you and you were running the VA desk, and they said, I was in Vietnam from 1967 to let's say sometime between 1966 and 1969. I spent a year there. Would you not consider that the first thing they need to be checked out on would be PTSD?
I would, yeah. I mean, it should be a physical and a mental evaluation completely, yes. And the guy who did the condo was a Vietnam veteran who is fighting for his disability right now, and he's only at 40%. And he was, evident in, no advocate has ever spoken to him about filing for Agent Orange. And he's 60-something years old. And been in the system, and why on the, that's my point, that y'all separate the medical and the benefit side, and it's like y'all put the veteran in the middle of the benefit side and the medical side, and it shouldn't be that way.
No, I disagree with you on that, but I do think there should be a better way to do it. I don't think that or any of my colleagues could say, okay, this person is, 60%, 30%, 20%, 100%, disabled by an emotional disorder.
Yeah.
No.
He's had medical issues I mean, it's not just his method, but he just now, 2 weeks ago, someone filed just the Agent Orange in case anything came up. I mean, he's getting older. And I know you don't have it, but I sent you one letter, and it's got the letterhead of the Columbia VA Hospital dated August the 25th, 2008. And I just want to read one sentence. One of the major concerns we discussed was that your CMP performed by Dr. Jeff Smith was changed by Dr. Martin Durkin. Martin Durkin is the director of the CMP department. The CMP exam was changed only after Dr. Durkin and Dr. Smith discussed your case in detail. And that's what the second fire on me. How can a CMP dictation, you can keep records of that veteran you was talking about from Vietnam. Y'all got his records, but CMP dictations are deleted in within a week.
I don't know about that.
I do, because mine was deleted, and it was changed by Dr. Durkin twice. I've got it, and it's documented. He changed two of my CMP exams, both of them by Dr. Jeff Smith, and in the letters you'll read, Dr. Jeff Smith actually sat me down when I was getting ready to leave, made me listen to his dictation, hit the pause button to stop the dictation, and asked me, Mr. Martin, is there anything else you want me to say in this dictation? I said, no, you covered it. He hit that, said, I'm done with my dictation, said the date, hung it up, and he told me to leave. It was 100% in my favor. Dr. Durkin changed that and deleted what that man said on that dictation. That dictation, I could never get the records of that dictation. And that's documented. August 25th. Well, this is when I met Mr. Byro. This is when I met the network director. And this letter is from Dr. Boykin, who was the chief of staff. I believe he's over the Charleston Hospital now.
This was who?
Dr. Boykin, he was. He was the chief of staff, Alfred B. Boykin Jr., MD. Chief of staff.
Okay. That was Smith and Durkin, is that what you... September 2007?
Yeah, that was September 2007. Yeah, conversation.
Okay.
And actually, too, if you look through all of my CMP exams, you'll see the director, Martin Durkin, changed two of my CMP exams. Two of my CMP exams. And I couldn't get the original dictation to either one of them. So you can defend this system. I understand where you're coming from. But you have to understand where my obsession is coming from. And this is it. I've got a nice patio with nice patio furniture overlooking a golf course. I've got 10 pack of highlighters, and I'm going through 7,000 pages and highlighting them. And I'm going to send my certified medical records and all this I got to a lawyer, and I'm going to donate any penny I get out. It's not about the money. It's not about anything, which I do believe I should be 100%. Y'all not y'all, the VA's put me through enough. If something was to happen and I was to die, I would only be 90%. Because I'm only drawing 100% for unemployability. I know how the VA works. So there would be no even burial. I wouldn't have even no burial benefits. And,
You know more than I do, but that's for sure.
Well, the one thing I did is I sat around and talked to the older veterans while I was waiting an hour and a half to 2 hours to see a doctor. And that's how I've learned what I've learned about the VA, about the benefit side, about the medical side, about the flaws that have been there for years, is because I am a talker, and they start a conversation, I'm getting in it, and I'm going to learn as much as I can. Like I said, my original claim started when I was in school. I was working with another lady who was older than dirt and mean as a rattlesnake. And she said, didn't you get, I asked her about a claim. I said, I don't understand this. She said, didn't you hurt your back in the military? I said, yep. She said, well, file your own damn claim, and that's how you can learn how this works. So that's how my claim started. That was the good Lord.
She was right on that. So now tell me something. Why the hell are you so anxious when you me.
All through everything I've said and the different doctors, the CMP being deleted, why would a doctor not make me anxious?
No.
But it's the topic. It's the 30 pages I assumed you was going to have.
No. That's BS. That's BS. Okay. Why should you be anxious coming in to chat with me?
Because the topic. Because of that paperwork. Right there, because I want you to know.
I want to know.
You want to know the source.
What is it that really, drives a lot of your anxiety?
The way the VA's treated me. And I do not want anybody else to be treated the way I've been treated.
Okay. You joined the Navy right out of high school.
I joined the Navy at the age of 15. My mother signed me in I had 4 years of junior ROTC in high school. I went in as an E3. Yes, sir. And was thrown up against the ship because an 18-year-old didn't blow the whistle and tell me that the ship was moving. So I was thrown in between an I-beam holding a 50-pound metal bar. So there went my Navy career right there.
And that was when?
19 years old.
And you were how long out of high school?
I stayed 2 months out of high school and then I went to the Navy. But I signed up when I was 15.
Right. So, how long were you in before you had that accident?
I served 3 years, 8 months, active duty.
How'd you like that?
I loved it.
And what did you do? What did you really
I started out because of a paperwork issue. I started out as an E1 because somewhere it didn't get put in as me being an E3, junior RTC. So I started out undesignated and I worked in deck department. I did that for deck department. It's chipping, painting, sweeping floors, but it gives you opportunity to go to any area of the ship and learn, which area you want to go into.
Right, okay.
And
what kind of ship? What ship were you on?
USS Concord, AFS 5. It was a supply ship, fuel and groceries. We were the grocery store.
Okay.
So I became a cook because we were a grocery store and we had the steak and the shrimp and all the goodies, that some of the other ships didn't. And they worked 15 days on, they worked 15 days off. So out at sea, I worked 15 days on, 15 days off. Now when I was at port, for last 2 years of me being in service, I worked 15 days at the Navy and 15 days at 7-Eleven. I had a part-time job. I've always had a part-time job.
Okay. So you really had the 15 days off?
Yes. Yeah. That was being at base to cook at 4:30, and then once you got done with breakfast, you got off, and then you didn't have to do lunch, dinner, or breakfast the next day. So, and then I would leave that morning after doing breakfast and go to 7-Eleven and work my 8-hour shift there. And then I work nights most nights on my regular days off.
So, how many cruises did you get to make?
1. Desert Shield, Desert Storm, 9 months, 9.5 months. Israel, Greece, went to the Suez Canal, France, Italy, Spain. I loved it. Absolutely loved it. Got drunk one time and preacher had to carry me up the brow, and the next port, he was drunk and I had to carry him up the brow, so I enjoyed absolutely every minute of it.
Where were you when you guys got drunk?
I think I was in Italy when we sat down at a bar and they outside brought a bottle of gin and a Coca-Cola piece, and we went through that bottle of gin and then we started the second bottle of college in, and they gave the cab driver $20 and put me in and said, take him to the ship. The cab driver dropped me off, and they had to help me up the brow. So, but I had a gentleman, I mean, in boot camp and on my ship. Stanley Payne was on my ship. He was a 40-year-old black man from Louisiana. He said, when you go to port, you go with me. First 3 ports. I always had someone looking out for me, and he did. He's what to do, what not to do, how to do it. And usually when I went somewhere, Sammy was with me or nearby me to keep me out of trouble.
That's all right.
Yeah.
That's all right.
So I am a pleasant gentleman. I don't want you to think this is me all the time when I leave here. That's not the truth.
Let me ask you something. How long do you think I've been doing what I do?
Apparently, almost as long as I've been alive, if that's how long you've almost been working at the VA.
Close. No, I haven't worked at the VA as long.
No. But in the...
Only about 4 years here.
Oh, okay.
Yeah, no, I've been drinking for at least well over 30 years. Almost 35, probably. Alright, so, no. I know who you are. Okay. I know who you are, Stephen.
I'd like to see those records explaining exactly what you think I am too, because I don't have access to them. I can't pull them up on my records.
Well, that's good. Because I think that sucks. I don't like that idea. Not at all.
I think it's my medical records. I should have access to it.
Your medical records, yeah. I have no particular problem with that.
I've seen the diagnosis you put.
I think psychiatry records, I think that's a little different.
Okay.
I really do.
So let me ask you one question professionally.
Sure.
Are the previous diagnosis to the VA correct?
Sure. I never paid attention to them.
Mood disorder, bipolar, I have PTSD, one of them said.
No.
I have.
Let's see. Oh, fuck. When did you have melanoma? Which time?
I missed my primary care appointment. I'm wondering why you haven't asked me about that. With Mr. McDonough.
Oh, yeah, I was down there.
I tried to explain that woman that we had already established I was going to have, because she changed, the primary care changed the appointment, but my labs were set here at Myrtle Beach on the 21st.
Right.
And that woman just kept explaining to me, well, this is the regulation, this is how we do it, this is the regulation, and it was at 8:45 in the morning when my pain level was about a 9. And she's telling me, you need to be fasting so you can do your blood work.
What she was trying to say, I thought, and I don't remember exactly, but I thought she was saying, you can do blood work here, is what I thought she was saying.
No, she was telling me she was chewing my ass because I was drinking coffee. She said, what are you doing? I said, I'm drinking coffee. She said, you've already had coffee? I said, yes, ma'am. Because the lab work was to be set up, and if she would have taken 2 minutes to read, she would have seen that the labs were set up on the 21st in Myrtle Beach.
This would have been the nurse, then, I presume.
Yes.
Okay. All right. Well, I agree with the anxiety disorder. I think I may have stuck that in there. Not bipolar. Major depressive episode. I think that's true. At least it was.
I don't doubt that. I've been through that. I conquered it. You might not believe that, but
Let's see.
I met it.
Crazy as a shit house rat. Yeah, I might go with that.
Hey,
That's not on it.
I would not.
I think you still have some depressive symptoms, my friend. But, I really do. I really do.
Okay. So I keep eating that pill I'm prescribed? I mean, because if that's the case, I've been on every medication y'all asked me to take, and ain't none of them work, except the Valium, and as you can see, at certain times,
What hasn't worked?
look at the list of psychotic medication. I mean,
I'm looking at at the citalopram, you know?
I've been on everything. Look in Colombia. In Colombia, they gave me methadone, my pain, anything, psychotic, anything in the book. I've been on everything that the pharmaceuticals make.
That's too bad.
And I still got a pill case that looks like a 70-year-old man ought to have. That so I can keep all them pills in order.
What should a 70-year-old man have?
A pill box like I do. And I'm 42, you know? I mean, I how many pills I'm on. But there ain't nothing wrong with me, you know what I'm saying? On the benefit side, there's nothing wrong with me. In any sense, mental or physical. Well, apparently mental, because that's how, I did pull it up, because now I have access to my records, so now I'm really 50% on the mental disorder. That's humorous to me, especially with the paperwork I have. I can't wait to see what the public says, who's the crazy one, when I'm through.
Well, we both agree that you've got an anxiety disorder, right?
Yeah, I do. And there are days, you know, I mean, it's not just doctors, I will admit that. I mean, where the anxiety gets, yes.
It's kind of social in a way.
In a large crowd.
Yeah.
But not in small settings, no. As a matter of fact, Sue's, even though the elevator's down, I went to her house and got my housewarming gift from her. The lady, it was supposed to be rented furnished. Well, the walls had chewed the box springs on every bed, looked like rats lived under the bed, they chewed all that. The furniture.
You don't want that. But listen, here's what we're going to do. I'm going to stop this citalopram selection, okay?
Okay.
And what we're going to do is we're going to switch that to escitalopram, which is a metabolite of citalopram, except it's better. You know it as Lexapro.
Yeah, I think I've been on that before.
I don't think so.
Seroquel, Lexapro.
No, that's different ballgame altogether.
Oh, they gave me that. Oh, trust me, they did take long for that to come out of my system. That don't work good with my brain. Those chemicals are not adjusted for Seroquel.
Well, I don't have you on Seroquel.
No, they did in the past.
Okay.
But it didn't work. It made me want to stay in the house. It made me want to not do nothing. You know?
Right.
I know, I mean, I moved away from my family after living in Myrtle Beach for a reason. You know, I mean, I came to the most peaceful place that I could live. And if I didn't want a happy life and to be content in my life, why would I'd still be in Lancaster County? Because with $4,000 a month coming in, you know, I could be living like a king back there in the woods where I come from.
Yeah, I know.
But I came to where, to get away from drama, to live a peaceful life and have the ocean and the setting. You know, I'm not trying to be a miserable...
Golf, do you? You don't play golf, do you?
No, but I tell you what, I'm addicted to hearing it go ping. When they hit that ball and I'm sitting out on that patio, there's nothing in the world that sounds better than that. I'm addicted. I do. If you could see my view, you'd fall in love.
I can just imagine, my friend.
The sunsets are awesome. And I mean, I could cast a rod off of my balcony and fish in the waterway.
Oh, shut up.
For $800 a month, for only and I lived in that one-bedroom condo for 3 years with same carpeting from 1997 and never been painted. And now I'm living in a palace for $100 a month.
Yeah.
So yeah, things are going good for me. I mean, honestly, I'm enjoying it.
All right.
But yes, I know I need to not try to have this disdain for the VA system that I have. I understand that. I understand that would be more healthy for me. I do understand that, but
And it also, see, everybody is not like me. Everybody's not, easy going and sort of who will sort of say, hey, you got to tell me that shit. I'm not like that. Okay? Then the folks would sort of back off and say, wait a minute, well, we don't want anything to do with you.
I bet that.
Yeah, I know, but that's not right. See, fair to you or to them. Okay?
Yes.
Everybody's knowledge here. Alright, so I'm sending you this citalopram, Lexapro. What you gotta do is keep taking the citalopram till you get it. Alright?
Yeah, okay. It's in my pillbox. I take